Welcome, welcome, welcome back, my Be Health Empowered family. It is that time for another episode of Excuse Me, Doctor. My name is Dr. Melissa Clark. Please, of course, call me Dr. Mel. I am delighted to be back here with you this week, bringing you all the accurate health information that you need to make wise health decisions, not just for yourself, but for your family and for your community. For those newbies who are checking in with us for the first time ever, welcome. And we would love if you could just go ahead and hit that subscribe button if you're checking us out on YouTube. And if you're with us on Facebook, please hit that like button. We really appreciate you for that. Now, let us get into creating a fantastic week for ourselves with all the wonderful health topics we are going to cover tonight. And to do that, I have to have with me my ride or dies, my co-host, Mr. Wayne Bruce, and Miss Lila Mays, coming from the West Coast and the East Coast. I kind of messed that up, but you know where y'all are. Welcome.
I didn't know if that was going to work. I didn't even know if that was going to work. It worked. Thank you, Lord Jesus. Oh, yeah. Thank you, Lord. It's appropriate for me to say thank you, Lord Jesus.
It is, because what are we talking about tonight?
The Black Church.
The Black Church.
Right. And exactly. And whether they're playing a
Okay, so the devil in everything.
The devil is big.
The devil is in everything.
We come against you.
Whatever. I'm almost ready to do the color purple thing.
All right,
we got Dr. Mel, because you froze.
Oh, okay.
The devil had you. We prayed you back.
Well, the topic tonight is about the Black church and what role are they playing with the health crisis the health crises that we are having as Black people. Critics of the church say, they don't pay enough attention to nutrition with all the soul food dinners, and that's all at the expense of the health of their members that might have diabetes and high blood pressure. But then on the other hand, we saw how churches stepped up during the pandemic and helped to close the COVID vaccination gap. So what is it? We have a panel of pastors here who are going to help us get to the bottom of this question, right? Is the Black church doing enough when it comes to keeping us healthy?
I love it.
Excited.
Yeah, I love it.
I love it.
So share this episode, y'all, with everybody who who really cares about this topic, because it's going to be incredible.
Yeah.
So before we do that, we need to go to the week that was in health and wellness. Now, I'm praying that this works. Right?
I'm sure it will, because it is the weekly recap. It has to work.
There we go.
Child, it worked.
Thanks, Wayne.
I'm about to tear up.
Okay. So, all right. So I'm gonna jump in here, Wayne. This first one up is white lung pneumonia. What is that, Dr. Mel? I mean, there are all these reports about it, taking out kids and reports linking it to China. What is the deal?
Yeah, I saw that.
So, I say don't believe the hype. If you're old school hip hop fan, you will feel that. So this white lung pneumonia is not really a thing. It's not even really a medical term. And it's not linked to anything happening in China. White lung is just the appearance on the x-ray when you have certain types of pneumonia. And it could be any bug that's causing it. It could be RSV, it could be flu, it could be COVID, it could be a bacteria called mycoplasma. The key is that there are no new bugs floating around out there that we're unfamiliar with. It's not linked to China. And I think it's, people are a little skittish because of COVID, but there's really no concern right now.
Okay, good to know.
Yeah.
That's good. So basically, there's no there, right?
That is right. There's not even an uptick in the rate of pneumonia diagnoses. They're kind of where they would be expected to be this time of year.
Wow, that's great. So look, this next topic hits directly to me. When I was in college, and I pledged a fraternity, one of my line brothers, who since passed away, had sickle cell, and he passed away from sickle cell. And so sickle cell treatment approved by the FDA. What is it?
This is big news.
Yeah.
So it's a new type of gene therapy, the first ever, and it can be used to actually cure sickle cell disease.
Wow.
Yeah,
That's
it's
crazy.
huge.
Mhm.
And the reason that, sickle cell disease was chosen is because it's basically a one gene disease. And what I mean by that is it's inherited. It's mainly found commonly among people of African and Mediterranean descent. And there's one gene that makes a protein called hemoglobin that's needed to deliver oxygen in your body. The gene that makes hemoglobin, when there's a variation in it, it can cause the hemoglobin to be shaped oddly and therefore cause your blood cell that contains the hemoglobin to be shaped sickle, hence sickle cell. And normally it should be round and it flows easily through your blood vessels, but when it's sickled, it causes traffic jams. They get hung up on each other and they stick to each other, and therefore blood can't flow and oxygen can't get to where it's supposed to go in the body, and you have these painful crises. You might know people who have sickle cell. And um, can you all hear me okay?
Yeah.
Okay.
Yeah, we can hear you.
All right.
Yeah.
So it causes pain and it causes organ damage, and it can even lead to death. So what this new gene therapy does is fix that gene. It actually replaces it with a gene that makes the regular protein that works well. And then those cells are actually, they take the cells out of the person's body, they fix them, and then they give them back those
Oh, wow.
those improved cells, and they're basically cured.
So I heard it's like $2
Wow.
million a patient.
Yes, it is with a huge price tag. And I kind of say this is like an episode of Good Times. Like how, wow, we have a football
We finally
scholarship, and then
made
all of
it
a
out.
sudden Keith blows out his knee. Right.
Keith is marrying us, and we finally go get out the hood.
Right. And then he blows his
Indeed.
knee out. Same thing. It's like there's a cure for sickle cell, but it costs $2 million. Right.
Wow.
So the federal government, states, insurance companies are now sort of grappling with and dialoguing about, how can they actually pay for this so that it can be made available to the people that really need it.
Wow.
Thank you. Thanks for that recap, Dr. Mel. I have to say, you broke down sickle cell in a way that I've never heard anyone else break it down. I never knew what the sickle part meant. So thanks for that.
And I too have a cousin who passed away from sickle cell. So it definitely is something I'm following closely, because hopefully generations from now, going forward, won't have to go through the pain and the suffering that disease brings.
Yeah, sure. All right. So we're back in cold and flu season. Lots of people are getting sick. I mean, I've had my participants in my program on distant locations with COVID, can't go to work, and like scrambling to, replace them and stuff like that. Like, it is rampant. People walking around without masks. What can we do, Dr. Mel, to sort of tamp this down?
So I recommend the FISH protocol. And that doesn't
All right.
mean, go out and get your fried whiting and all that. What it actually stands for is food or nutrition, immunize, sleep, and hygiene. Okay, that's the FISH,
Wow.
right? So food, stock up on foods that help your body fight viruses, thin mucus if you do, make your mucus thin, improve your cough, and keep your immune system healthy. So that includes hot teas, broth-based soups, fresh fruit and vegetables, and garlic. Garlic actually has antibacterial, antiviral fighting effects. So all those things are great. Immunize. So get your boosters, your flu shot, your COVID booster. And if you've had COVID recently, wait about 6 to 8 weeks after you've had it to go ahead and get the booster.
Okay.
Sleep. This is the season, 'tis the season to go party, go Christmas shopping, to be stressed out. And you're doing exactly the opposite of what the seasons recommend. This is a time to actually hibernate. You actually need more sleep. Right?
Wow.
People are doing the
Mhm.
opposite. So get sleep so your body doesn't get run down. And then lastly, H for hygiene. Wipe down surfaces, your shopping cart when you go shopping, your doorknobs at home, and wash your hands, of course, while you sing the happy birthday song. 20 seconds. We learned that during COVID. Don't forget. So
Right.
that's it, the fish protocol.
All right. I love it. I love that. Make note of that, people. Fish
All
protocol.
right.
Make note.
So
All right.
we have that new segment we were talking about last week, right, Lila?
We do. Call What Y'all Think.
What y'all think? So
this
set it
week
up
we-
for us.
We
Yeah,
gotta
this
set
week
it up
I
all the
talked to
time.
some young people on the street about an article where a celebrity was talking about having had some regrets about her, specifically her derriere augmentation. But let's get into it, Wayne. And so I read an article where Nicki Minaj is saying that she regrets having had any augmentation to her body. What do you think about that? Would you?
I would maybe sometime in the future. I believe that we have a choice to do whatever we want to do, and I think it's important, most important, for people to feel confident about themselves. And so, if the time comes, I want to get rid of my crow's feet, or snip some fat after I have a baby, I would do it.
Okay. All right. Thank you.
You're welcome.
Think. Okay. So I recently read this article where Nicki Minaj is saying that she regrets having had any augmentation to her body. And I'm just wondering what the people think. Would you ever, you have any thoughts to share about that?
I think it's like a really personal decision. I actually had my boobs done.
Okay.
I love that. I had that done. Works for me. I don't want to take them out. I'd be mad if they got flat. But sometimes people do it like for health reasons.
Okay.
Sometimes people go overboard and then they're just not happy with the results. And I hear that it's super addictive. So
But not in your case. Not addicted to your case.
I'm not addicted.
Okay.
One shot, one kill for me.
All right. Thank you.
You're welcome.
What y'all think? I love to hear the word from the street.
One shot, one kill.
I love that. That's what she
One
said.
shot,
One
one
shot,
kill.
one kill.
I got my boobs done.
Well, and I
Those
love her
boobs are
confidence.
deadly, ma'am.
Yeah.
So, we did like 2 shows on plastic surgery over the summer with Dr. Paul Thesiger, and we talked about 2 really important issues. One is
Okay.
very important for women to feel, control over their bodies. But we kind of talked about it in the context of, what determines beauty, right?
Mhm.
And when we're making choices, they're really choices that might be dictated by social pressure. And then the other thing was people are often going to the cheapest alternatives, the quote
Right.
unquote chop shops in
Mhm.
South Florida and other places, even overseas, and not necessarily vetting the surgeons adequately and running into health problems. We saw that, of course, with Kanye West's mother, and I think another couple other cases recently.
Hey,
So I think,
Michelle, and
Yeah.
yeah, Michelle, exactly. Yes. And
One, two. We lost Dr. Mel. We lost her
her audio.
a social media star also died recently. So I think it's also taking it into account not just Nicki Minaj regretting her decision, but also if you're thinking about plastic surgery, thinking it through all the way. Why are you really doing it? And then if you are going to do it, vetting the doctors that you do get and not necessarily just going with the cheapest alternative.
Yeah.
Right. Be empowered.
Right. Being health
Be health
empowered.
empowered. Come on there. Lies on top of her, on top of her.
What y'all think? So we're going to do that again. That is fun. Thank you so much, Lila.
You got it.
Well, we are going to move into our segment for tonight. I mean, it's like, 180 degrees, talk about plastic surgery and butt lifts, to talking about the Black church. Now, Reverend Martin Luther King had a quote, which I actually have on my Facebook page: "Of all the forms of inequality, injustice in health is the most shocking and inhumane." He said that as a minister of the Black church, in parallel with efforts to combat segregation in hospitals, which was leading Black people to get substandard health care. 57 years now since he said that, we're still getting substandard health care, well documented in medical journals. The question tonight is, does the Black church still have a role to play in advancing the cause of closing healthcare gaps and bringing healthcare justice? We have three incredible guests with us tonight, three outstanding pastors who are going to help us walk through this and take your questions later on. The first is Reverend Kimberly Williams. She is the executive director of Choose Healthy Life. Welcome so much to this program. Thank you so much for joining us, Reverend Williams.
Thank you, Dr. Clark. It's a pleasure to be here.
And then we have Reverend Karen W. Curry. She is the First Lady and Associate Minister of Pennsylvania Avenue Baptist Church in Washington, D.C. Thank you so much for joining us, Reverend Curry. I'll call you Reverend Karen, if that's okay.
Oh, that's wonderful. Thank you so much, Dr. Mel. I'm really excited to be here.
Wonderful. And you'll see why I have to call her Reverend Karen, because we have Reverend Kendrick E. Curry here, who is the senior pastor of Pennsylvania Avenue Baptist Church in Washington, D.C. Welcome so much, Dr. Curry. Thank you so much for being here.
Well, thank you so much, Dr. Mel. This is an exciting time to be with you this evening.
Well, we're going to get right into it. The first question, I'd love for three of you to weigh in on it, perhaps starting with Reverend Williams. Is the Black church the right venue to address health issues? And if so, why?
Thank you again. I do believe that the Black church is absolutely the right location to address health issues. And the reason being is because we have always had the trust and we've always had the support in our communities to be able to speak to our congregations and to our communities. We are where the community receives their faith-based education, knowledge, biblical grounding. And so we are the ones that have helped to position what I would call a true bridge between faith and science. The Black church has always been staple in our communities because if you think back, you used Dr. Martin Luther King's quote, our churches have always been impactful for change. And so in this instance here, the Black church is looking to be not just the house of faith, but to provide a wholeness to our communities by addressing their faith, addressing their health, addressing their mental wellness. And so I believe that the Black church is the organization to do this because we speak a very unique language. We speak the language of faith, but we also speak the language of culture. And there's so many things that we have our finger on the pulse when it comes to our communities and our congregations, that we are a trusted home where people feel safe getting that information and that knowledge. And they also feel safe bringing us their questions. So I think that we have a unique position of really helping to address and provide resources.
Wonderful. Now, Reverend Karen, do you have anything to add?
Well, I certainly agree that the church is the place. We talk about often our church family, and that's because the church is another part of our family. It's an extension of our family. And so family is the place where, as you're able, you try to have some of those important conversations where you have sometimes even some tough love, and you have some encouragement and support. And so all of the things that it will take for us to be healthier with regard to our eating choices and other things that we do, the church is the perfect place for us to be able to have those kinds of conversations and make sure we're really looking at our whole self when we're talking about being well and whole.
Now, Dr. Curry, Reverend Williams mentioned the union of faith and science. A lot of people sometimes think that those two things are at odds, right?
Absolutely.
You are actually a PhD in chemistry. Tell us how you
Chemical engineering,
reconcile.
but we'll say, yeah.
I'm sorry. I get the.
It
I
will
get
be
the subject.
chemical engineering,
I'm-
and that's it's a little bit different, but
It is. It's very
related.
different. It's very different. But your PhD is in a science, chemical engineering. How do
Yes.
you reconcile the two, the faith and the science?
Brilliant question. One of the things that we have to understand about science itself, science is being the study of something, is that when we understand our faith orientation, we have to understand that God provides science. So God is the first scientist, if you will. And when you begin to look at reconciling faith with your science, you begin to understand that when all things are put together, you have an understanding of how God has enabled us to study the stars, to study biology, because God created everything. And so when you recognize and reconcile all of this together, you start to see that human beings created in the image and likeness of God, that likeness being part of a situation, quite frankly, where we actually recognize that we are like someone that is of divine intelligence, then that helped us begin to understand what faith is really all about, what science is really all about. It's acknowledging everything that who we are and what we are, and taking the study of to understand and appreciate what God has done, what God is doing, and what God is going to do.
Now, thank you for that answer, because I asked that question because we saw during the pandemic the power of the Black church with a specific health related issue, and that was COVID and COVID vaccinations. And there were some churches that sort of set that up as a dichotomy, like just have faith that you're going to be okay. You don't have to get vaccinated. Most of the Black churches that I know, though, were encouraging people to get vaccinated. Reverend Williams, maybe you could tell us how Choose Healthy Life, what that is, and how it brought together Black churches to address closing vaccination gaps in the Black community.
Absolutely. So Choose Healthy Life is an organization that was founded by Deborah Fraser House. And she created this organization to be an answer to our communities when COVID hit. And so we're located in 5 national cities. We're in New York, Newark. We are in Washington, D.C., Atlanta, Georgia, and we are in Detroit, Michigan. And one of the things that I would love to share with you is that we have over 120 churches located in 13. We were located in 13 states. During the pandemic, Choose Healthy Life was very instrumental in doing that marriage and helping to provide information and to get people tested and vaccinated. And we did that through our community health workers that we call navigators. They played a very vital role, and they were very instrumental in helping people to get the education they needed for COVID and to be aware and knowledgeable about the vaccines and which vaccines were available, the dosages that were needed, only because they provided the type of information that our community members needed. And so at that time, we were twice as likely to die, right? We were dying at astronomical rates. And so
3 times in some instances.
absolutely. And so Choose
Yeah.
Healthy Life was able to make the information digestible. I think one of the questions you just asked, Dr. Curry, was instrumental. We believe in prayer, but we believe in prayer and medical knowledge, education, and medical resources. And I often like to say, you know, I find it unique that God placed Luke in the Bible and they call him the great physician. I think that that was God's way of saying, hey, I want you to pray. I want you to read your Bible. I want you to have faith. I want you to seek some medical care. And so we were able to help our community by providing those resources. And then lastly, we were able to bring clergy members together. When our pastors stand over the pulpit and give direction and they take the charge and try to move it into our communities, our clergy were the first in line to say, get this COVID shot. And by the way, let me roll up my sleeve and take the COVID shot. And we were instrumental in a huge way by providing this to our community. And it was an effective approach for those to see, hey, the vaccine is indeed safe. And hey, we should get our vaccines. And I think that that model has helped us. And it helped us tremendously in seeing the impact throughout the community where the positive cases were reduced and people were now vaccinated.
Yes, definitely very impactful. Now, COVID is still with us, even though the pandemic is over. And so, Dr. Curry, what direction are you taking at Pennsylvania Avenue Baptist Church as far as specific health-related initiatives that might be focusing on preventing the diseases that put us at risk for COVID in the first place?
So, yeah, thank you for that. You know, we are a praying church, and one of the things we do in terms of our discernment is to understand what's happening with regard to the social determinants of well-being that help each and every person understand what they do in life. 80% of who we are is social determinants. As we begin to think about those things, we look at the demographics in our own particular neighborhoods. For example, in the Ward 7 where I am right now, we have the highest incidences of kidney disease in the country. And we also have the highest mortality rates. And so it becomes incumbent upon us as a church to respond to the needs as Jesus would to those who are in sickness and dealing with their own conditions of illness. And I say that because Jesus came doing three things. If you really read before the parable of the on the Mount, he literally came preaching, teaching, and healing. This is what churches are called to do. We are to preach, to teach, and to heal. And part of that is not only the soul salvation of your body, but it's of your soul, but it's also that of your body, which is able to transform local neighborhoods so that neighborhoods are stronger. And as neighborhoods are stronger, communities are stronger. So what we do at the church is really identify what those particular issues are that are taking out our people in the context of community. And then we go after those. So we then develop partnerships that help us to follow through on what we've said.
What are some of those partnerships? Yeah.
Some of those partnerships, George Washington University, me participating with oncology, their ward and being part of their cancer support group. Also with Leadership Council for Healthy Communities, LCHC, which is dearly beloved. And looking at how we can do things like Choose Healthy Life, where we can provide vaccines, where we can do Blueprint for Wellness, which does an entire body scan and screen, where we can also participate with groups like the DC Dream Center and Howard University and deal with food insecurities and overcome other sorts of substance addiction. So we're engaged in a host of things that are aimed at targeted solutions. As Jesus came preaching, teaching, and healing, so we come preaching, teaching, and healing through our partnerships and with a solid plan that's aimed at transforming our world through the love of Jesus Christ.
Thank you so much, Dr. Curry. So Reverend Karen, I had mentioned in the introduction about some critics of the Black church talk about the nutrition or the lack thereof in the food that is served. And that might be a little bit simplistic, but can you share any successful examples of wellness initiatives that might center around nutrition that the church has implemented to really impact the members?
Absolutely.
And I hear you have a communications background, so I'm sure communications is a big part of that.
Oh, absolutely. Absolutely. You have to almost do a public relations campaign in terms of getting people to change their mindsets with regard to, especially what constitutes a good meal at a church. We often joke about the gospel bird and that's fried chicken. And my husband, Pastor Curry, and others will say, those birds died that we might live, and so, but trying to get people away from just equating that fried chicken and all of that, what we would call comfort food, with being at the church. One of the things that I am excited to be able to do as First Lady, I wear a number of hats, but one of them is as a health navigator with the Choose Healthy Life organization. And so very honored to serve in that capacity and help our folks actually get exposed to some different things that will help us choose healthy life. I actually made a poster from one of our events, and I added the tagline to the Choose Healthy Life piece, and it says, "We do have a choice. Choose healthy life." And so what we do whenever we have events now, we are very intentional about having some choices. If we're going to have fried things, which we have less and less and less, we'll also have baked. We'll also have something else that's very tasty, and we make sure it is, so that people can have something else to actually introduce their palate and say, you know what, I actually could have a good meal without having thus and so, the other things that will send our sugar up or our blood pressure up. And I've been very intentional. We just had a Blueprint for Wellness event this past Saturday, and we have a health event with some partners tomorrow. I actually go out and shop at our new local grocery store and find healthy, affordable, and accessible snacks to provide for those events. And I'm telling you, whenever we bring those snacks out, they go. The people love them. And then we make sure we have the box there so they can see what it is, see the ingredients, and know that they can get it right in our community so that they can continue eating and introducing something into their diet. We have an electronic sign on our property, and I put a message on that sign that said, healthy eating too tough, start with healthy snacking. And so just to get
I like that.
just at
Baby
least
steps.
you can snack healthy, and
Yeah.
it's working bit by bit. And so now when I have these events, I got to bring that healthy stuff that folks are looking for. So just thankful to be able to make those kinds of inroads.
You mentioned the new healthy grocery store in your community. Now, a lot of health, as Dr. Curry mentioned, is actually determined at a policy level. Are there healthy grocery stores in a community? How many liquor stores and marijuana dispensaries are cropping up in the neighborhood? Are there green spaces and healthy air, jobs and economic growth, school quality? How can the Black church influence its policies on a local, state, or even federal level that impact our communities? And that's for you, Dr. Curry.
Sure. Thank you for that question. It's a very powerful question, because one of the things that churches are obligated to do is not just be service oriented, but they have to build capacity so that we can advocate for what we need to have. One of the things that we have to advocate for are more grocery stores. Now, in where we are right now, we only have 2 grocery stores for over 70,000 folk. And so we have to deal with that. And now,
and that's less fresh, healthy produce, right?
And that's fresh, healthy produce. And folk are just missing it. Now, unless you can afford to go across the river and gain what you need, then that is an issue you have to contend with. But I do point out a great illustration that I can point out during the time of COVID. And it points to the nature of the disparity, and it points also to the importance of advocacy. During the time of COVID, we were caught with a situation where literally there were people from the Black and Brown communities who were not able to assess the COVID vaccine as they needed. And in my capacity with working with DC Health and doing all of the things that we do in the city to advocate and to serve, I challenged the health department here in the District of Columbia to allow us to start a pilot. I said, just give us 300 vaccinations, just 300 vaccines, and let us see what we can do over a weekend. And I guarantee you, things will turn around and you would be able to use churches as a way of disseminating the vaccine to a wider population. Well, they didn't believe initially that churches could do it. And so after constantly advocating and then putting them to the test to create a pilot, they then gave what I asked for. And that's the importance of two things. Number one, if you're quiet and you say nothing, then you will not be an advocate that can be able to change your situation.
The squeaky wheel gets the most oil.
The squeaky wheel gets all of the grease, right?
Yep.
It makes noise, it gets the grease. But then we were able to demonstrate success or impact. It's not just the fact that we can advocate. It's when we receive the information, the dollars, and the resources that we can then lead to the impact and deliver. That's the value of the church. That's ultimately what we're trying to do in terms of understanding what it means to really overcome policy challenges. We create impact, and then the policy makers and those policy wonks in downtown DC and other places will come to find you and say, how can you do this again? Because they want to engage the community, but they don't know how. So come to the church. We're the trusted, incredible messengers, as Dr. Williams has already said. It's part of our mission. And we have the capacity to be able to deliver the impact that they need to transform our communities. Hello.
We've been talking a lot about physical health, but I want to switch to mental health. And this is a really kind of sobering statistic. The good news for white people is that they were the only group to see a decline in their suicide rate from 2018 to 2021. Every other ethnic group's suicide rate went up, including Black people. We increased by about 19%. Now, due to racism, Black individuals have always had more social stresses. And it seems that whatever has been protecting us has been losing its effectiveness. So, Reverend Williams, this question is for you. Are there ways that the Black church can address the stigma around seeking mental health services within the Black community? And how do you navigate discussions about mental health in the Black church?
So I definitely think that the Black church can address this. And we too have to, and we acknowledge the uniqueness of the social stresses that our communities face due to systemic racism and its impact on mental health, right? So we believe in fostering open discussions about mental health. We also believe in making sure we're using the right language. So often our communities are impacted by the language we use. And so we are very intentional about using mental health, mental wellness, as opposed to mental illness, because we believe that language basically supports a stigma that our community has often shunned away from when it came to receiving those resources. So we are providing spaces for support. We're providing spaces for resources. We're creating environments where our communities and congregations can come together and have these discussions. We're also looking for Brown people to produce and have workshops, do webinars. It's important that our people speak to our people. I know that people don't want to hear that, but our communities receive from our own. Seeing one another in the space helps us to open up and have more fluid conversation. And the other thing that we're very excited about is that we recently partnered with Johnson & Johnson to address this issue in a programmatic way. And so in the state of New Jersey, we have implemented this partnership to spearhead directly our discussions and our work on mental wellness. And so we provide, and we're committed to addressing this thing heads on. This is one of those opportunities that Choose Healthy Life has really utilized to say, we believe in prayer, but we also believe that we need the support, the resources, the safe spaces to have these kind of conversations, and to be able to provide the uniqueness that is necessary for us to open up. So we create those safe spaces for it to be done. And we also recognize the deep urgency around addressing it. When we were in the pandemic, mental illness of our community was impacted in a huge way, because so many of our families, our church families, our families did not get the type of closure and the support they needed. And so that has been a very primary—
Meaning relative to their loved ones dying of COVID.
Yes, absolutely.
Yes.
So we believe that needed to be addressed by addressing the toll that put on people's mental, the mental mindsets. And so we believe in the approach of, we want to continue to use our faith, right? We believe in prayer. We believe in the power of prayer, Bible study, all of the tools that God has provided in our toolbox. And we believe in seeking counseling. We believe in providing the resources and the support. We believe in having those conversations.
And I think that's important to put those two together, that it's not an either or. I can't believe that we're already at the time to take questions from the audience, as we have such a rich discussion going. Lila and Wayne, what are you all seeing in the chat? Do we have any questions for our esteemed colleagues here?
We do indeed. You want me to take it, Wayne?
Yeah.
Oh, okay. So this question is for Reverend Kendrick E. As violence has been declared a public health issue by the World Health Organization and in DC, where does the Black church fit into addressing the upswing of interpersonal violence?
Yeah, I can answer this, and I think my wife can too, because we tag team on this. I will say this: the church has to be at the center of this violence, and it has to unpack why we're dealing with this issue of violence. We're dealing with issues of violence for multiple reasons. Some just because folk don't have the resources that they need, inadequate distribution. But there are other situations that we talk about mental wellness. And even at Pennsylvania Avenue Baptist, we're dealing with mental wellness. We have, for the last 10 years, have a day treatment program that is aimed at dealing with some of those who are your most violent offenders, some of those that have recently been returned from being incarcerated, and we find them as means of developing systems and ways and means and how-tos of how to begin to think through how the church, along with its partners, are able to curb the tide of violence. So the church must be at the center of it. And we must, yes, use our scripture, thou shalt not kill, among others. But we must also be intentional about how we help to resolve the root causes that lead to those that are engaged in violence.
Yeah, absolutely. If I could add to that, as we talked about making space for people to deal with mental wellness, Of course, that's a factor as well when we're talking about violence. And so we literally have made the space available in our church to work with an organization, MBI Health Services. And then we tag team with them where we'll do some things ministry-wise to connect, as they deal with helping people to learn conflict management and to deal with stress and all of those other things. Then we come along with the spiritual piece, and it just becomes this wonderful partnership. And one of the things that I had an opportunity to do some years ago is to work with a ministry by an African-American woman called the Time to Fly organization, Time to Fly Foundation, excuse me. And they are focused on domestic violence and helping persons to heal and helping, even when persons have gotten out of a violent relationship, there's still some healing because they may find themselves right back in that cycle if that's not addressed. And so there's a step-by-step program that the Lord has enabled her to be set up that is faith-based as well as counseling-based and free to persons. And so it's been a wonderful opportunity to really see firsthand how people can become healed and whole. And I remember one example where a woman who went through the program got really free, even while she was yet still in this situation she felt to stay in with her husband, but the husband ended up coming around and he got free. He got convicted spiritually because as she got stronger and knew who she was in the Lord, he was a believer too. He was just, not believing in terms of how he was behaving, but her change stirred him and he changed, and they both shared their testimony at one of the banquets, and it was just incredible. So the church,
come on, Jesus.
Yeah.
yeah.
We fall down, but we get up.
Amen. Amen. Amen.
Come on,
Yeah.
Jesus. I have a two-parter for any of you. As ministry leaders, has your community engagement grown as a result of your health-focused partnerships? Second half of that is a question from Yvonne Smith. How do you reach the people who are not members of your organizations?
So I'll take that one. We have a very, I would say yes. The answer is yes. We do get the engagement. And the reason why we get the engagement and Dr. Curry addressed this is because Choose Healthy Life has been very unique in what I call the AND formula. So we will engage in health in our Blue for Wellness, and we're addressing some sort of social determinant of health the community may have. So many of our churches will do events addressing, say, they'll provide food and health resources. They'll do a coat drive and provide health resources. Some of our churches have done some very unique events like providing the community with free haircuts and some type of wellness resource. And we've been able to gain the engagement of not just the congregations, but the community. And I think another major part of that goes with the family spirit that we have within our communities, right? Word of mouth with family members always makes a difference, right? Come and see what this church is providing and what they're offering us to help us with our lives to improve our health. One of the things in specific areas, we tend to have a high undocumented population. And so most of our events are always at no cost, which that word of mouth spreads. You can get your vaccine, come down to the church. And so I would say we're getting that engagement because we provide the AND formula. Right now, a lot of our churches are doing toy drives and they're providing health resource community. And so I think it's very important that what we do is we see them, we receive them, we're there, it's safe, it's not a judgment space. If they're not willing to do those things, we still give those resources no matter what. So it gives them an opportunity to come into these warm environments, be welcome, be nurtured. Sometimes you're planting a seed, you're watering, you're fertilizing, and then they might do a screening the next time once you gain their trust. But I definitely believe that that's been the way we've been able to get the engagement, because we're addressing issues that we know our community is facing and providing those health resources within the community. So I definitely would say that's the formula to getting the engagement, really utilizing the family narrative of providing and seeing what we're in need of and what resources we can provide, not just from that wellness space, but addressing other social determinants of health that they may be incurring at this time.
Absolutely. You know, the "and" piece describes it so well, Dr. Williams,
Yeah.
because we certainly are doing that. It's this and that, not this or the other. Even back to the question about whether or not to get the vaccine or to have faith, it was both, right? I would say to people, you know, how you use your Lysol to spray for germs and things, so you pray and spray. You know,
Yeah.
like, you know,
Right, spray and spray.
let's just have it.
Are
Let's
we
do
in-
it all. Let's do it
Right.
all. But we've come
Right.
out of the walls, and that's what has allowed us to reach, to answer the caller's question, to reach those who are not in the church, not the members. We are very intentional about going to a park area in our community where people do a lot of different things. And I'll never forget when I invited someone to come and meet us there, they didn't think that's where we were talking about. They thought surely it was some other quiet, nice space that we were going to be ministering at. And we said, no, people are hanging out in this area doing lots of different things. This is where we're going to come. We're going to come and show love and spend time and connect and bring food and resources and no judgment, but love and connection and help. And that we started even before COVID. And so we just intensified that. And so quite frankly, when we go down, my husband and I, they call us Pastor Curry and First Lady. They look at us like, this is church. And it is
Meet them where they are. Right.
Right. So
Literally, if I can just say this 2 seconds, literally where they are.
Yeah.
We leave the church and go to the place, and we will take vaccines. We will take information and resources so that those who are engaged in opioid trade will find themselves being able to find the help that they need.
Okay.
Wow. That's
Amen.
amazing.
So,
I think we're probably in the lightning round, right?
so
Right,
we
Wayne?
are in the lightning round. So I'm going to need all. I know y'all pastors. I got it. I need y'all to condense these answers. As a producer, I'm going to need you to condense
So,
the answers. So here we
Do
go.
we have time for one
So-
more question?
So we
Okay.
we have time. So we have a question from Rhoda Lawrence, who is our West Coast producer, but she is watching today. And she asks, how do churches join Choose Healthy Life movement or program or start a program like that?
So that's a wonderful question. As we are continuing to build out our infrastructure and grow, right now we are working to secure additional partners. And so I would say go to our choosehealthylife.org website and submit your information. When we make it over to the West Coast, because we believe we will definitely contact you and see if we can start a Choose Healthy Life program in your church or in your congregation, wherever you may be. But right now we are asking that in the cities where we are located, that people will go to the website, see where we're hosting events, and partner with the existing churches. Our hope, and this is why it's so important, and I had the opportunity of presenting today to say we've got to pay attention to what's happening in our federal government. Pay attention. These are the things that really impact our ability to grow and get the funding we need for sustainability. So my ask is that you go to our website, submit your information, and we'll connect you any way we can to a Choose Healthy Life.
And that website is
choosehealthylife.org.
all right.
Choose Healthy Life. One more quick question. You were talking about healthy snacks. Do you have healthy cooking classes in church to promote healthy eating?
Yes. As a matter of fact, we've started something called health breaks, where we just do maybe about 20 minutes or so. We bring the healthy snacks and then we do a demo as a part of that. And so we demonstrated making a healthy salad, a healthy and hearty salad with some ingredients that we might not always consider. And it was a hit. And so absolutely, some quick recipes. We will also give recipes. We make smoothies from scratch right there on the spot, and let people see all the fresh and wonderful ingredients in them. So absolutely, yes. That was
All right.
quick.
Wonderful.
There you have it.
All right. Well, I'm getting that signal from my producer that we have to wrap up. This has been an incredible time for the Pennsylvania Avenue Baptist Church. We know Choose Healthy Life's website. What's the Pennsylvania Avenue Baptist Church website?
You going to give it, Pastor?
Sure will. It's www.pabc-dc.org. That's Pennsylvania Avenue Baptist Church DC.org. PABC-DC.org.
All right. Well, thank you all so much for joining us tonight. I think it's been a really invigorating discussion. I'm pleasantly enlightened to understand everything that is going on both at Choose Healthy Life, Pennsylvania Avenue Baptist Church, and the impact that is being made in our communities. Thank you again, of course, to Lila, what y'all think, and Wayne, our producer. Thank you so much for keeping us on track. And I just want to thank you all, the audience, for asking fantastic questions, as always. And, until I see you again, remember, in this holiday season, to be wise, to be well, and to be health empowered. Thanks so much for joining us.
This must be Big Mama. She's over 65 and she's on dialysis. But she's boosted, so the worst that I could do to her is a rough 1 or 2 nights at home. But James here, he's not boosted. And he never gets off the couch. And he's got diabetes. Do you know that 40% of the people who die of COVID have diabetes? But his wife here, she hasn't had her second dose yet. So I'll be still with her because women are 4 times more likely to get long-term COVID than men. Yeah, I'm glad to be sticking around here. I am so glad they let me in.